Hello again, everyone. My name is Walt Schoenborn from drbicuspid.com, and welcome to today's 2 p.m. Eastern Daylight Time webinar. Hope everyone is enjoying the Dr. Bicuspid virtual conference thus far, and we're pleased to present to you Using Dental Dams in the Age of Coronavirus, sponsored by COLTENE and presented by Mary Costello, CDA Emeritus, EFDA. Today's presentation will help you understand the importance and benefits of using dental dams for infection control for protection from infectious diseases. It'll help determine which dental dam products are suitable for specific dental procedures, as well as application of dental dams using either the winged or modified wing technique for endodontic isolations. Additionally, the following webinar will help you understand the guidelines for selecting the appropriate clamps for various clinical conditions and application of dental dams using the general field isolation for quadrant isolations. Mary Costello is a CDA Emeritus, EFDA, and has a BS in Health Administration from Governors State University, Illinois. She has over 50 years experience in the dental field, serving as an expanded duties dental auxiliary for the U.S. Army, a dental coordinator for a hospital-based dental center, and a dental dam instructor lecturing throughout the United States and Canada on dental dam dentistry as manager of continuing education and professional relations hygienic products for COLTENE, Inc. Mary currently is an independent dental consultant. We've got a great program for you today. Please stay tuned for a live Q&A session after the program. Give me a moment to connect with Mary and enjoy the presentation.
Good afternoon. I'm pleased to be here today. My name is Mary Costello. The title of my program is Using Dental Dam in the Age of the Coronavirus. Upon completion of this program, you will understand the benefits and importance of using dental dam for infection control. You will be able to select dental dam products and accessories based on guidelines discussed today. Finally, more application techniques will be described, which will expedite dental dam isolation for endodontic and quadrant isolations. Since dentistry is classified in the very high risk category of occupations involved with aerosol production, use of the dental dam is strongly recommended. Studies have shown that the use of dental dam have decreased microbial contamination by 99%. Other benefits include moisture control, which results in increased access and visibility of the operating field, thereby increasing operating efficiency. In addition, the patient is protected from the aerosols produced during the dental treatment or from inhaling or swallowing any foreign objects. A large quantity of instrumentation is not necessary to incorporate dental dam into your practice. Dental dam kits contain all that is necessary for its application. It is generally more cost-effective to purchase a kit versus purchasing individual components. Dental dam is available in 5-inch or 6-inch ready-cut square sheets. The 6-inch dam is for either endodontic or quadrant applications, while the 5-inch dam is for endodontic and pedodontic applications. Dental dam comes in a variety of colors and thicknesses or gauges. The darker colors provide contrast and is recommended for restorative procedures. Some operators still prefer the light colors for endodontic therapy since they reflect light onto the operating field. However, with current lighting technology, the darker colors are more popular. Medium gauge is the most frequently used for either endodontic therapy or restorative treatment. The heavier the gauge, the more gingival retraction is achieved, which makes this gauge popular for restorative procedures. Elasti-Dam is the new generation of latex dental dam. It is powder-free with low protein levels. The modulus of elasticity has been lowered to produce a product with greater tear and puncture resistance. Most importantly, it is easier to apply. Elasti-Dam is available in 5-inch or 6-inch ready-cut sheets in green or blue in medium or heavy gauges. For individuals with latex allergies, there are latex-free alternatives. The non-latex dam is available in 6-inch ready-cut sheets or the frame Flexidam with an integrated frame. The integrated frame is flexible, which makes it ideal for taking radiographs during endodontic therapy. One area of great confusion is selecting the appropriate clamp for clinical procedures. Let's review some basics. There are two types of clamps, winged and wingless. The wingless clamps are generally denoted with a W before the number of the clamp. In order for a clamp to be stable, there should be 4-point contact of the clamp's jaws to the tooth surface as shown in the diagram. Please note the example depicting the correct placement of the clamp. The tooth receiving the clamp is called the anchor tooth. A large variety of clamps is not necessary for dental dam application. The Fiesta color-coded clamp pack contains the most commonly used clamps in either winged or wingless styles. The color coding makes for easy identification when selecting for specific teeth. When selecting a clamp, one must determine the size of the tooth, its condition, meaning is the tooth structurally sound or compromised, and its eruption pattern, whether it is fully or partially erupted. The most commonly used anterior clamps are the number 9 series and the 212. The number 9 and the W9 are recommended for canines, laterals, and centrals in either the maxillary or mandibular arch. The 212 is a specialty clamp used for restoring class 5 cervical lesions. This clamp is not recommended for use as a single tooth isolation. Popular premolar clamps are the 2 and the 2A series. These clamps may also be used for pedodontic isolations. The 00 clamp is indicated for small premolars. Most individuals have no issues with the clamp selection for anterior premolars, but the availability of large variety of molar clamps can make selecting the appropriate clamp very confusing. Molar clamps generally have 4 jaw styles. The flat jaw clamps, such as the 7 or 3, are recommended for mandibular arch, while the curved jaw clamps, such as the 8 and 4, are more suitable for the maxillary arch. For partially erupted molars, clamps whose jaws are curved with the points of the jaw slanted in an apical direction are indicated. Essentially, it is the 4-point contact that stabilizes this clamp. Examples of these clamps are the 14A and 8A. Finally, there is the serrated jaw style clamps such as the 13A and 12A. These clamps are recommended for structurally compromised teeth that are fully erupted in either upper or lower arches. Please note that one jaw is larger than the other. The larger jaw is placed on the buccal aspect of the anchor tooth. The Wedgett's Dental Dam Stabilizing Cord is a clampless alternative to clamps. The cord is available in both latex and non-latex in size small and large. The yellow and orange are latex, with yellow being small and orange size large. Lime green and turquoise are non-latex in small and large respectively. Wedges may be used wherever there is a contact present. Wedges may be used for either endodontic or quadrant isolations. Greater lingual access is achieved when a mini isolation of 3 teeth is used for endodontic procedures. For quadrant isolations, Wedgett's cord may be used on either end of the isolation if a contact is present, or a clamp may be used to secure the dam on the posterior. Marking the dental dam may be accomplished either using a template or a stamp. If a stamp is used to mark a box of dam, make sure it is permanent ink product. When punching the holes, it is recommended to punch the hole sizes as shown in the diagram. If the holes are too large, it will make it difficult to obtain a moisture seal around the necks of the teeth. In the wing technique, it is easier to place the dam on the frame and then punch the hole for the anchor tooth. The wing clamp is inserted into the dam and the unit is simultaneously taken to the mouth. Once the clamp is seated, a composite instrument is used to stretch the dam off the wings. This technique may be used for either endodontic or quadrant isolations. In the modified wing technique, it is an easier method of applying a wingless clamp. Once the dam is punched, water-soluble lubricant such as surgical jelly is applied to the tissue side of the dam. That's the side facing the patient's tooth. The bow of the wingless clamp is inserted into the dam, and the dam is reflected back to expose the jaws of the clamp. After the clamp is seated, the dam is stretched open and pulled nasally lingual during treatment. 3 holes are punched, keeping in mind that the endodontically treated tooth should be in the middle. Water-soluble lubricant is placed on the tissue side of the dam. The dental dam is placed over the teeth, and 2 wedges cord are placed on either end of the isolation to secure the dental dam. When removing the dam, the wedges cord is removed first. The interseptal dam is cut with the scissors. Protect the patient's lip and gingival tissues by placing a finger in the facial vestibule and pulling the dam away from the tissues. Cut each interseptal dam separately, making sure that the point of the scissors is facing away from the gingival tissues. Remove the dam and check for missing interproximal pieces. The geral field isolation is a quick and easy method of isolating a quadrant when traditional dental dam placement is an issue. It provides isolation of the lips, cheeks, and tongue. 3 holes are punched, a wing clamp is inserted into the anchor tooth hole, and a slit is cut between holes 1 and 2. The dam is carried to the mouth and the clamp is seated. The dam is stretched anteriorly to include all the teeth to be isolated, and a wedges cord is placed to secure the dam in place. The dam is then stretched off of the practice is easy. Keep it simple and get organized. Dental dam kits provide all the materials you will need to get started, and the Fiesta color-coded clamp pack will assist with clamp selection. Products as the Frame Flexidam make application easy and simple to accomplish. As you increase your usage of dam, you will become more comfortable with its use. Better still, train your dental assistant to apply the dam. Most states permit dental dam placement as an expanded function. Today it's the coronavirus. Tomorrow perhaps another infectious virus. Using dental dam will contribute to reducing microbial contamination in the workplace, thereby protecting your patients, you, and your staff. Isn't that a good reason to regularly use dental dam?
Thank you, Mary, for a great presentation. At this point, we're going to open it up live with Q&A. So we ask everyone to type their questions into the chat section of our screen, and Mary will try to address them in this portion of the program. For any questions that are not addressed, please visit the SciCam booth afterwards, and they'll be able to help you there. Mary, can you hear me okay?
Yes, I can. Now, do I need to click on that chat? I see a number 1 there.
Nope, you're all good. You're all good. We can hear you loud and clear. And I have a couple questions I want to run by you, if you don't mind.
Sure.
So the first question we got in was, I was taught to place a winged clamp on the tooth and then stretch the dental dam over it, but my dam keeps tearing. Why is that?
Well, unfortunately, you were taught to use the traditional wingless method instead of the wing technique. In the traditional method, the clamp is placed on the tooth and then the dam is stretched over the clamp and tooth. And the reason the dam tears is because you're asking the dam to stretch beyond its capability. If you use the wing clamp as I showed in my demonstration on the slide presentation, you shouldn't have any difficulty with the dental dam tearing. But you must make sure that you use a blunted instrument, such as a composite instrument, when you're stretching the dam off of the wings. Otherwise, you can tear the dam during that process.
Great. We just had a question that came in, and it asks, any way for hygienists to use without a clamp for quadrant scaling?
I'm sorry, excuse me, what was that, please?
There was a question that came in. Is there any way for a hygienist to use without a clamp for quadrant scaling?
Yes, to use wedget cord, you need a contact. So the thing is, I know if you're doing the quadrant, you may have to use the clamp on the last tooth in your isolation, but you can carry it forward with your wedget cord. That general field isolation that I showed, you can do a quadrant isolation because you are going to need to get access to do your scaling. So the general field would probably be more appropriate. You will get some protection because you have the dam rolled over on the buccal and lingual vestibules, so that'll help. Now, I know that one of the practicing dentists that his hygienist used to actually use a traditional method of isolating the dam with actually placing the dam between the teeth. And I can't say that I actually witnessed the process, but I suppose if you were to do it that way, you would just basically treat the dental dam that's overlaying the tissue as though it's additional tissue and using your scaler to get down into the sulcus. But if that's too much of an issue, I would try going with that general field isolation. Unfortunately, if you're going to be scaling that last tooth in the arch, and you can't use the wedget cord because it won't stay. There's no contact, so you almost have to have a clamp on that last tooth in that arch.
Sounds good. I also have another question here. Are there any issues with using a matrix system when using dental dam?
No, not generally. I've not experienced the problem. I do have to recommend that if you're restoring the last tooth in the arch of class 2 restoration, and you need to put a matrix system on that tooth, ideally you'd like to leave the clamp in position and put your matrix in place. So in order to do that, if you use a clamp whose jaw is flat, you will be able to seat your clamp more readily. Sometimes you actually have to remove the clamp and replace the matrix system in place, restore the tooth, and then switch out the clamp back on the tooth. You try not to do that if you can, but that is another method that you may have to do depending on how deep the carious lesion is.
Sounds good. We have a question here from Robert Sherman, and he's asking, why do you think there is such a low number of dentists who routinely use rubber dam when research shows reduced microbial burden in aerosols, reduced moisture, but also increased longevity for posterior composites?
Yeah, for as many years as I've been in dentistry, that question's always come up. And the thing is that I think sometimes it's a matter of mental attitude. Dental dam has a learning curve naturally. I think once you become comfortable with its use, you will find that you'll use it more readily. And unfortunately, getting past that negative attitude sometimes is very difficult. So I usually suggest using that general field isolation. That kind of gets the person into the mode where they say, hey, using dental dam isn't that bad. And I think it's the two main issues is selecting the clamp and passing the dental dam between the contact areas. And so using a water-soluble lubricant on the tissue side of the dam will facilitate getting the interproximal dam between the teeth. Using wax floss to pass that through will help as well. And so those are probably the two negative issues in facing the use of dental dam. And as I said, if you can get a little more practice, as they say, practice makes perfect, you'll feel more comfortable with using the dental dam. And yes, I love Dental Dam. I've used it in my 20 some odd years in clinical dentistry, and I wouldn't even think of working without it. And most of the patients we use Dental Dam 99% of the time. And so again, start, I think, with the quadrant isolation using the general field. And also I think the non-latex dam is easier to apply as well. And again, using that water-soluble lubricant like a surgical jelly will make things easier as well.
Mary, I want to thank you so much for your time. It was a fantastic presentation. And please, everyone who is attending, strongly encourage you to go visit the COLTENE booth after this presentation in the virtual exhibit hall. Mary, thank you again, and look forward to speaking to you in the virtual exhibit hall.
What I wanted to make a mention in the exhibit hall, we were able to download videos of the actual isolations that I discussed, and so you can get a better idea of how easy it is to apply Dental Dam if you look at those videos.
Fantastic. There you go. Please visit the COLTENE booth in the virtual exhibit hall, and you'll see the videos that Mary is referring to. Mary, thank you again. And everyone, please enjoy day 2 of the Dr. Bicuspid virtual conference. Thanks again, Mary.
Thank you. Thank you.